All right, so continuing with the second half of chapter 1, looking at the scientific method. So basically, the scientific method is just a system to understand behavior. It's what psychologists use to um, acquire knowledge and learn about humans. And I'm sure, like, I don't think this is probably the first time that you have heard of the scientific method, but it's a good reminder. So, your first step is to identify what your question is. What do you want to know about? Number two, then you want to formulate an explanation. So, you have to come up with a hypothesis. And so, think of step one as the theories. So, theories are broad. You think that people who own dogs are the best. Okay, well, that's a theory you can have. But then the second step would be, how do you test that? And so you would have to come up with a question, or it can be a statement in some cases, that is testable. So how are you going to measure whether people are better if they have a pet? And then three, you would carry out that research. So once you identify your hypothesis and you figure out how you can test it, then you have to actually do the research to see what you find. And then four, you have to communicate those findings. So you have to put the science out there so other people can replicate it and see if it stands up when other experimenters do it. So psychological research, descriptive research encompasses a few different types, I guess you could say, of research. So the first one being archival. So archival research is going to be data that already exists. You're not creating anything new. You're going to a system or older books or older data that's been collected before, and using that for whatever your current research question is. A naturalistic observation is where you observe behavior or something that is happening in the world. And the key with naturalistic observation is that you are not intervening in any way. So you are not manipulating anything. All you are doing is observing. Survey research, this is probably what everybody's most familiar with. Lots of different surveys out there, and you have a sample and you can collect surveys in many different ways these days. And then a case study. A case study is where you investigate usually like one person or like a very small group to figure out if there's anything, like a deeper dive into whatever's going on with them. So those are less likely to be to find any universal findings. So universal meaning that something that's going to apply to all humans, but it might tell you something interesting about people who have a very similar experience to whatever's going on in your case study. So correlational research, I think this is probably in psychology the most common that you'll see. So basically with correlational research, you're looking at two different variables and then you're trying to examine to see if they are associated. So for example, let's go with a dog example. So let's say that I think people who spend more time with animals are happier. Okay, so my variables are happiness and spending time with animals. So those are my two variables. I want to see if they're correlated. So they could be positively correlated or negatively correlated. So the important thing to remember with this is that positive and negative are not being used in the sense of good and bad. That's typically how we normally talk about positive and negative. But what this means in terms of research is that if something is positively correlated, when one variable goes up, the other variable goes up. Okay, so positive, both variables go up. If something is negatively correlated, then that means one variable goes up and the other variable goes down. Okay, so if I was, like I said, studying happiness levels and then amount of time spent with animals, if they were positively correlated, then they would have high happiness levels and high amounts of time spent with animals. Versus if there was a negative correlation, then it could be a lot of time spent with animals, but low happiness. Okay, so that'd be a negative correlation. They are not correlated in that way. And so basically you would run statistical formulas. You could use SPSS. Some people use SAS. Those are things you would get into in a research methods class. But the important thing to remember is that just because there is a correlation, that does not mean that there is causation. So if there is a positive correlation between happiness and spending time with animals, that does not mean that spending time with animals causes happiness. So maybe people who have time to spend with animals are wealthier. Maybe they can afford to have animals. So that could be a confounding factor in that there could be other things that are going on that make a person happier. So a certain amount of wealth that doesn't have anything to do with animals. Animals are just a sort of side effect of having that wealth. So that's what we mean when we say that just because there's a positive correlation, that doesn't necessarily mean that that is the factor or one of the factors that is causing whatever positive relationship. Okay. For experimental research, so this is when you're trying to establish causation. So if we for sure want to know that time with animals increases happiness, then we would have to do an experiment to figure that out. Those are not easy because you really have to have a sound research design, have the ability usually to have a research lab where you can control all the other factors aside from the one that you were trying to isolate to study. But it's definitely more common, obviously, in like biology and the sciences and things like that. There are definitely experimental psychologists, don't get me wrong, and psychologists who run experimental labs. It's just most of my experience and the faculty that I've worked with typically do more qualitative research, so more interviews, things like that, versus experiments. So when you're doing experimental research, there's an experimental group and a control group. The experimental group is the group that receives the variable. So there's a couple studies that I've looked at that were trying to measure college students and if they did better on a test when they pet a dog before they took their test. And so what they did was they had the same professor and half the class was taking the test on one day and half the class was taking the test on another day. And the first class got to pet a dog before they took the test. And then, so they were the experimental group. They got the variable. The variable was petting the dog. And then the second class just came in and took the test sort of like normal. So they were the control group. There was no variable associated with their experience in the research. And then that would tell you like, hey, we've controlled all these other variables. It's the same professor, it's the same class, they've had all the same information. Sorry if you could hear my dog bark. And they're taking the same test. The only differences between them are between the experimental group and the control group is that one group pet a dog before they took the test. And if you're curious, the results showed that the students who pet the dog and then took the test did better than the control group. So the independent variable is what's manipulated. So getting to pet the dog is the independent variable. And then the dependent variable is what happens after the dog is pet. So test scores are good or bad, right? That the test scores are dependent on what the independent variable was. So this last part, the ethics of research, we're going to have a day on ethics later in the semester where I have some interesting scenarios to think through about how to handle them. But just so you know, psychologists, like it says, has really strict guidelines to protect research participants. You have to make sure that they aren't going to be harmed. You have to make sure that their results are going to be private. And you have to give informed consent. So you have to have a really thoughtful, specific, informed consent letter that they have to sign so they know exactly what their participation is going to involve. Obviously, it has to be voluntary, and it usually has to include a debriefing. And I'm going to talk a little bit more about this in class. And then, so lastly, avoiding experimental bias. This is where you don't want the participants to kind of know your preferred outcome of the hypothesis. So if you're coming in to take a survey about if you think animals are great or not, and I'm giving out the survey and I have a shirt with cats and dogs on it, like, they're probably going to put 2 and 2 together, right? That would be me affecting the environment. And we know that participants want to please the researcher. So people just naturally try to decipher whatever research they're participating in and sort of guide their answers to what they think the experimenter wants. There's a placebo. I'm sure you've heard this word before. There's the placebo effects. There's placebo pills. That's where you hear it most often. So when people are trying to test a new drug, you give the experimental group the live drug, and then you give the control group a placebo. So everybody, and then the participants don't know whether they're receiving the experimental drug or the placebo. And then you could also have a double-blind procedure, and in that case, the researchers also don't know who is receiving what. So the doctor, when they come in to treat the patients, they don't know if they're treating a patient who is receiving the experimental drug or the placebo drug. So they're treating the patient in the exact same way because they don't know. Because previously, you know, historically, like, if they did know, then they might just treat the patient differently. Okay, so I think that's it for the rest of this chapter. Hopefully that kind of talks you through all these kind of different terms and stuff like that. Of course, let me know if you have any questions, and we can talk about it more in class.